ambulance. What's the emergency?
Quickly, we're at Southport.
Okay,
On
Southport.
The Gold Coast, where the lights burn bright and the sunshine never ends. While many Aussies call it home, every year, 12 million tourists come to play on this stretch of golden coastline.
He was surfing when he got bitten on both legs by a shark.
I don't think I'm going to the sea again.
But the good times
We get some medical staff.
can often turn ugly.
Pelvic binder on him, okay?
And when they do,
Maybe that you've had a heart attack.
these are the people you want on your side.
This is Princess Charlotte. So we've got her a room with a view. Good.
This guy doesn't die, there's a good chance he's going to end up with a horrible brain injury.
Whether you're just visiting
Love you.
or you live here,
This dude seriously got attacked by a buffalo.
Oh my gosh, she's biting me.
Are we getting any sort of a blood pressure out of it? He could still lose this leg.
these are the real stories
Okay.
Yep.
of the cutting-edge medical teams
Do not move your
We
head.
need to go in and get that clot out straight away.
Good work, guys.
who pick you up,
Okay, let's get moving.
You may get some chest pain. We're inflating the balloon now.
patch you up,
Superpower! The fairy dust. It's very magical and it fixes all sorts of things.
and put you back in paradise.
Where else would you rather be?
Tonight on Gold Coast Medical.
No one has seen me without my prosthetic bra. Not even my husband.
Now she bears all
You ready for this?
for Dr. Raja to work his magic.
Sorry. You okay?
Yep.
Oh my God, I hope he's falling down that gap.
Paramedics go off the road to control a confused man.
What's wrong, mate? Hang on. Mate, just relax.
Miracle Surgery saves their smallest patient.
There's nothing more awesome than saving children's lives. I'm feeling happy.
Hey, Johnny. Hey, Terry.
And the crazy plastering team are in for a tricky pull.
Oh, my God.
If you think the Gold Coast is a great place to be a plastic surgeon, you're right. But for the hospital's head of plastic surgery, Dr. Raja Sawhney, it's not all about making the locals bigger or more beautiful.
The cosmetic surgery side of it is quite interesting, but the reconstructive surgery side I find much more rewarding and interesting and challenging. Like breast surgery, when I'm doing a reconstruction for someone from breast cancer, I have to have artistic ability to make it aesthetically pleasing, otherwise it would take away from the result.
Dr. Raja's next patient is 46-year-old mum Tracy. She had both breasts removed due to cancer.
Before I start any breast reconstruction, I take an interest into that patient's life, because otherwise you can't give them the best reconstruction for that person.
After the trauma of the mastectomy and chemotherapy, Tracy was reluctant to have Raj do a breast reconstruction.
I had decided not to have it, and I went to my last appointment to see him and tell him that I didn't want it done. And he's got a very nice bedside manner. He said, no, it'll be easy. Of course, it's easy for him. He's holding the knife.
Eventually, Tracy came round to the idea of improving the look of her bust.
It's the worst looking thing you'll ever see in your life. No one, apart from the plastic surgeon or the nurses, has seen me without my prosthetic bra. Not even my husband. I actually taped up our mirrors for quite some time. I had black plastic halfway down the mirrors, so you could only see from the shoulders up.
After 5 years relying on prosthetic breasts to give her a feminine shape, Tracy has had enough.
I'm always saying to my husband, are they level? Are they in the same spot on each side? You're forever walking down the street and you get your hands and you'll just move them around. And the kids will go, Mum, really? You're in the supermarket. Oh, yeah, OK. These aren't proper prosthetic bathers, but you learn to compromise because you want to look pretty. And all the other bathers are for old manners. It has controlled my life for 5 years, and it's controlled my kids' life and my husband's life. And I'd be quite happy just to move on and forget about it. Down on the beach, watching them in my bathers, not feeling self-conscious, that'll be a good day.
Every year in Australia, around 200 people die as a result of workplace injuries. That's 4 people a week. It's an alarming statistic. But it doesn't surprise Gold Coast paramedics Dane Barnard and Trent Croxford.
So we're going to a 38-year-old male who's fallen off a ladder. He's got patient injured head, back and neck. Patient fell out approximately 3 metres. His ALOC bleeding from the head, so that's where we're heading to. There you go. From ear, oh Jesus. So we got bleeding from ear as well, which could be a head injury, all right?
If the man is bleeding from the ear, it could mean he has a life-threatening brain injury.
My God, I hope he hasn't fallen down that gap. Where are we going, guys? Oh, you're standing up, mate. So.
The injured man is Stephen.
Go.
Despite plummeting 3 metres to the ground, he's up on his feet and walking around, but he appears extremely dazed and confused.
So how long ago did it happen? 10 minutes? Remember how you landed, or?
No, I have no idea. I don't know what.
You know where you are at the moment?
Not really, no.
Okay, we're going to lay you down. We're going to put a collar on your neck there, all right? So just sit down nice and...
Even though he's walked away from the scene of the accident, he may still have a serious neck or spinal injury. So fitting a spinal collar is the first job.
Nice and still, mate. Nice and still.
Do you want to just cut his shirt off while we're here quickly?
Yeah. And other than that pain on your head, do you have any chest pain, any other arm or leg pain? Obviously, when
Just
you fell,
wash your hand.
Obviously, when you fell, you walked anyway. Any other pain anywhere as such? No. Cool, mate. Cool.
His confused state of mind is one thing, but with blood still dripping from his ear, Dane and Trent know they could be dealing with a major head injury and they need urgent backup.
Thanks, mate. GCS 14 patient is bleeding from internal ears.
All going well, Corinne and her husband Roscoe will be expecting their first baby in 7 weeks.
Hello, how are you? Good, how are you?
They didn't want any surprises, but life doesn't always go to plan.
So do you know if you're having a boy or a girl?
Boy.
A boy.
Yes.
And just 2 weeks ago, they found out their little man has a big problem. His bowel is blocked.
That's good.
We'd had so many different steps to this pregnancy. It's been kind of, this last few weeks, there's been 2, 3, 4 things a week constantly.
As soon as the baby is born, he will need immediate surgery so he can feed.
Excellent. I don't know if you...
1 to 2 days after he's born, they'll put him under and do that surgery. But yeah, I mean, we've been consulted by 9 different specialists today. Like, it's been kind of excessive, but we're kind of prepared for everything.
Babies normally start drinking the fluid from their mum's tummy from around 15 weeks to help get their digestive tract going. But because of the blockage, he can't swallow any of it, so the fluid builds up.
At this stage, we're not 100% clear at what level that blockage is. In Corinne's baby's case, the amniotic fluid that the baby's been swallowing will go into the stomach, empty into that duodenum, but because it's got no way out, there's a blockage somewhere that stretches and gets bigger.
So today, Dr. David Elwood and midwife Tione Newirth will drain 2 litres of the fluid out of the amniotic sac.
So, Corinne, you understand what we're about to do?
Yes?
Yep.
Put a little needle in and then leave the catheter part in and then remove the fluid.
Yep. Excellent.
Oh, yes, it is cold.
Yeah, it's freezing.
We keep this in the freezer, especially.
To make the comfortable pregnant ladies uncomfortable.
Okay, now I'm going to pop the needle in.
If the fluid was left to build up, Corinne would go into early labour. But the drainage is also risky.
One of the biggest risk factors is that the woman can go into preterm labour because we have gone through the uterus into the sac. Essentially, the bag of waters around the baby can rupture and she can go into labour.
But no one wants that to happen today, because if their little boy comes early, he could be too tiny to cope with corrective surgery.
Are you okay? What's wrong?
Yeah, I just feel like a little bit of pain in there.
A big contraction happening.
Yeah.
47-year-old Tracy had both breasts removed 5 years ago as part of a treatment for cancer. It will take 2 major surgeries to reconstruct new breasts, and it's a process that Tracy has been dreading.
Alrighty, Tracy, how are you, darling?
Good.
Good. You ready for this?
No.
Can you stand up for me, darling?
Sure. No one has seen me without my prosthetic bra. Not even my husband.
Sorry, darling. You okay?
It's a horrible feeling.
Sorry. You okay?
Yep.
Won't be long now.
I can do this for me, not for anybody else. I can do this for me.
If Dr. Raja can successfully reconstruct Tracy's breasts, it will heal some of the physical and emotional scars since her brush with cancer.
When we do the nipple reconstruction,
Dr. Raja Sawhney begins the first stage of a reconstruction by marking Tracy's chest where he wants her new breasts to be. For the next few months, Tracy will have temporary expanders under her skin.
so we put them in flat, deflated. We put them in under the wounds where the breast base is. Expanders in today, a couple of weeks to heal. Then we'll start filling up full of fluid. Then you'll have breast volume and you can help us decide what you want as far as volume's concerned. What the expanders are there for is to create a bigger soft tissue envelope or skin envelope, if you like, because she's flat-chested. I can't go and put implants straight in. All right, nice to me, thanks. We can stretch all the skin and then we can go in and put the definitive silicone implants, which are longer lasting, more durable, and that will give her better breast shape overall and feel.
Raja makes a pocket on each side under the skin and pectoral muscles, large enough to fit the expanders. The air is removed from inside each expander balloon, and then Raja squeezes them into the envelope he's prepared. Once the wounds are closed, the first injection of saline solution begins the transformation, and Tracy's new chest takes shape. Corinne and Roscoe's baby boy is due in 7 weeks. His mum and dad just found out he has a blockage in his bowel that must be operated on as soon as he's born.
Really well.
It's causing a build-up of amniotic fluid in Corinne's womb that needs to be drained. But this type of procedure can also cause premature contractions.
Are you okay? What's wrong?
Yeah, I just feel like a little bit of pain in there.
The uterus starts to contract around where the needle is and gives you a sort of sharp pain there.
As the slow process goes on, Corinne's pain levels rise.
A big contraction happening.
Yeah. Alright, try not to make your legs sweaty.
Each bottle reduces the pressure, but the pain is causing contractions.
As your baby's deciding to have a big wriggle.
Come on, baby, no.
Very inquisitive little man.
He gets that from his father.
We're getting quite a collection there.
About another 50, we must be getting pretty close to the 2 litres.
After an hour of agony, the contractions safely pass.
Waiting to see, or you're not really sure, it's better just to come in.
They took 2.3 litres of fluid off in the end, so that was a lot, but I feel so much relief, and
He's a lot smaller, so that's a good thing.
more painful than I thought it was going to be, but worth it. Everything's over now.
There was so many bottles. There's like 7 bottles of half-litre bottles or whatever. Like, it was ridiculous.
But just a few weeks later, Corinne is back in hospital.
Hold it longer.
This time, in labour a month before her due date, and it's not going well.
No, it's not going to happen.
Her little baby boy has no intention of coming out.
Corinne, do you mind if we re-examine you?
No.
Okay, so she's been pushing for an hour and a half now.
Yeah.
Now, normally we recommend pushing no longer than 2 hours, getting up close to that mark.
The next step is to use a vacuum grip attached to the baby's head.
You still have to work exactly as hard as you've been working, okay? And what happens is that little cap goes on his head, okay? And then as you push, Dr. Lick will pull. It's just going to deflex his head a little bit and it just makes the diameter a bit smaller so that he comes out. But you still have to really, really work.
The vacuum should help, but it won't be the easy delivery Corinne was hoping for.
So ready when you are. Take a deep breath and big push. All your energy right down. That's it. Push, push, push.
Gold Coast construction worker Stephen has plunged 3 metres off a ladder onto the ground, hitting his back, neck and head.
Nice and still, mate. Nice and falling about, so just crossing on that first line. He looks like he's landing on his left side. So he's a bit confused, but got a few injuries, but we're just trying to determine that. So.
Critical care paramedic Jay Newton has just arrived on the scene after receiving a call to assist with a major trauma.
Where does it hurt?
Across my back in the back there.
Do you remember what happened?
I really don't understand, no.
The bleeding from Stephen's ear suggests there could be damage to his brain. It's critical they get his pain under control and stable enough to transport him to emergency.
Okay, Steve. All right, going to be a sharp scratch in your arm, okay?
So it looks like he's come down the left side, so he's hit the left side of his head. And his left arm's got grazing, so it sounds like he's sort of chucked that down.
Yeah, thanks, comms. As previous subject, ICP on this vehicle, mobile up to...
Do you remember falling yet? Have you had a memory of how you fell or what happened?
Trent continues to test Steve's memory.
Do you remember landing on your feet? Not really? Okay, mate.
Stephen is still unable to remember anything from the accident, and he is becoming increasingly more agitated.
Can I just turn around that way, because that...
What's wrong, mate? Hang on. What's wrong? Try and keep straight for us. Steve, try and keep straight, mate. Try and keep straight. Steve, try and keep your neck still, mate. Try and keep your neck still.
Get this... Why the is that?
Steve, just relax, mate. Just relax.
With Steve now fighting the spinal collar and becoming more aggressive, the convoy of paramedics have no choice but to pull over to the side of the road to get the situation under control.
No C-spine protection at all. So...
Now, can I borrow 50 mils of normal saline, never to be returned?
Mum of 3, Tracy, had both breasts removed because of cancer. Today, plastic surgeon Dr. Raja Sawhney is giving her the chest she's only dared to dream of.
Over the ensuing 6 to 8 weeks, we'll slowly inflate that expander up to a reasonable volume.
The gradual process will stretch skin pockets on each side of Tracy's chest. Then expanders are swapped out for permanent silicone implants.
I like to involve my patients with decision-making of what size and shape they want, because that gives them an ownership of what we're doing for them and involves them with their care, essentially, and their restoration of what they want. And we get happier patients that way, and goes to reason that they should be involved with the decision-making process since it's really their body.
Tracy is hoping to end up with a D-cup bust, so there will need to be several more top-ups with saline solution over the coming months.
It's always nice for them to wake up with some fluid in there and see that there's a bit of breast tissue. It makes them feel like the procedure was worthwhile.
She's got
probably an A-cup breast out of that, especially on her athletic build. She'll feel that. And in a couple of weeks' time, we'll probably put another 100 mils in, and then 2 weeks after that, probably put 100, 150 mils in, and she'll practically be reasonably at where she wants to be.
A fortnight later, Tracy is well on the way to achieving her ideal bust size.
Wednesday just gone, they put in another 100 mils. 2 more visits, 120 mils each, and I'll be done. I have a cleavage. I don't have to wear a bra. It's just me, which is nice.
Best of all, the new body means it's time for a whole new wardrobe.
Dressy dress or casual?
Dressy dress.
Dressy dress, OK.
Yes.
This is new in, the Shona Joy. Would you like to try something
That's
like
nice.
that?
That is nice.
OK. There's also this style here, which is strapless as well, with a bit of a V plunge at the front. How about a red dress?
Look, you never knock back a red dress.
OK, let me grab one for you. Something like this.
Yeah.
Thank you. You're welcome.
When the final silicone implants are in place, Tracy wants to be ready to party.
OK, what do you think of this one? It does look lovely, though.
It does look lovely. And do you know what? Oh, I'm going to cry. Sorry.
It's all right.
It's the first time in 4.5 years I've had a dress on with no prosthetic boobs, with no bra, with no crop top.
It's all
so
you.
it's a bit overwhelming.
Yep.
My husband used to always say, you're beautiful anyway. But he walked in the other night after Wednesday, having them expanded, and he walked in and he went, oh my God, they're huge. And I said, well, hang on a minute, they're only half done. He said, really? He wants to play with them.
Oh, this one's lovely too.
I think he's happy because he can see a change in me. I'm a lot more comfortable within myself. I am glad I did it.
It's a wedding dress, a race day dress, a ladies' luncheon, date night.
I can wear almost anything I like now, and that, as much as it's very overwhelming, it made me feel good. The cleavage and being able to wear something a little bit lower. I don't want to say it, but yeah, it does. It makes me feel like a girl again. Girly girl.
It takes all sorts to work in a hospital, and without a doubt, these two are an odd couple.
Hey, Johnny. Hey, Terry.
He was feeling so ashamed.
Orthopaedic technician Terry Kelly and his good mate John Evans have been plastering broken bones for over 30 years.
Can you speak up just as phone's podgy? What do you got?
Today is clinic day, which means every patient that needs a cast set or repaired pays them a visit.
Tuesday's usually complete bedlam. You can have up to 100, 200 patients coming through. So you never really know what's coming around the corner.
Okay, what do you need me to do?
Main thing is relax your leg and don't try and lift. Let us lift, because if you lift those bones and they pop out, we get very upset.
Okay.
Yeah, I started off as a nurse, became an orthopaedic nurse in the orthopaedic ward. Then I started running orthopaedic clinics up at the Royal Brisbane and Royal Children's and stuff. And now I'm actually a fellow of the Institute.
Even so, Terry's the first to admit that these could well be his twilight working years.
I'm 56 now, so I've got that many years left.
But for now, Terry's got to patch up a carpenter who snapped his thumb bone playing footy.
So you rest it nice and gently on a nice comfy pillow above the level of the heart. That keeps circulation good.
Yeah.
Heals up real quick.
As long as I can grab a beer.
Well, don't be grabbing too many beers until you see the orthopaedic doctor.
With decades of nursing and plastering under his belt, Terry knows his stuff.
You ever had bees' knees? Yeah, Bee's Knees is the oldest beer made in Australia. Have you ever heard of the term, he's the Bee's Knees?
Yeah.
It actually comes from that beer. It's made from the knees of bees. You know the pollen that comes from the knees of bees?
Yeah.
They actually make the beer from that.
How do you know all this stuff?
Hey, I have had a few beers.
But the laughs soon stop as Terry gets a call about a young bloke who's come off his mountain bike, badly dislocating his elbow.
If it stays dislocated like that for too much longer, yeah, he could bleed to death, he could have his arm crippled, and it could kill him.
Just gonna go cold in your arms, Steve.
Paramedic Trent Croxford is struggling to keep his patient under control en route to the Gold Coast University Hospital.
What's wrong, mate? Hang on. What's wrong? Steve, just relax, mate. Just relax, okay?
His patient, 38-year-old Stephen, has fallen 3 metres off a ladder at a building site and has become so agitated, the team of paramedics have pulled over to calm him down.
917, yeah. Nice and chilled out.
No, Steve, just try and keep your head and your neck nice and still, mate. Open your eyes.
Take it easy, mate. We're looking after you, all right?
With a suspected brain injury, it's critical they get their patient to hospital immediately. Every second they stall here at the side of the road could impact his chances of recovery.
Still hemorrhaging out that ear.
Jay, you still got
It's
active
still,
bleed out
it's still,
out
it's just a.
internal canal.
Hang on, Steve.
What's the skill, buddy?
Why do you want it off?
Just talking about.
I know it's that way. Yeah, no, mate, we can't. Unfortunately, we can't let you lie. No, hang on, Steve. You have to lie flat on your back, mate. We can't let you lie that way.
Critical care paramedic Jay Newton administers the heavy pain sedative ketamine to get him under control.
We're just trying to get you to the hospital the best we can, okay?
So our concerns for him is that if he's bleeding on the inside and continues to bleed, that his brain could start to swell, and then he could have a significant head injury from that. What he needs is a CT scan to have a look at what's going on in the head.
Still, mate.
Paramedics Trent and Jay have had their hands full trying to treat a construction worker who's fallen on his head with life-threatening bleeding from the ear.
Yeah, but she still needs...
On arrival, patient was walking around, walked to the bed. So he did have a period of combativeness en route, mainly due to agitation possibly of his injuries. He's got bleeding coming from the left ear. Appears to be some sort of bit of a hematoma on that sort of left, just behind that ear there.
Yeah, you go. Do you feel sick? Tell us if you feel sick.
Before he can be sent for CT scans of his brain, Dr. Rajesh and the emergency team need to assess his level of consciousness and physical injuries.
Can you give us your date of birth? Your birthday? That's all right.
Hang on. Where are you going?
Just stay still, mate.
Stephen? Where's it sore?
Sorry, what was that?
Still in a highly agitated state, another dose of the dissociative drug ketamine is given to ensure Stephen doesn't become combative during the scans. It's imperative he stay calm and remain still. Extensive 3D imaging will reveal if the bleeding from his ear is a result of potentially life-threatening bleeding on his brain.
Yeah, you can just see the skull fracture runs through there, from there. That's not supposed to be there. So that's what you call a base of skull fracture. It'll be going under the neurosurgeons, but we still have to look at the other injuries.
The medical team calls Steve's family to relay the news.
He's okay at the moment, and obviously he'll need to stay with us. I'm not sure that he'll need an operation or anything at this point. But as I said, at the moment he's okay. But we're worried enough about him as you are.
He's stable right now. Yeah, so the major injury that he's got is an isolated head injury. He's got a skull fracture, and there's a small bleed as well. It looks like he might have injured his lower back as well. Right now he's stable. He'll be admitted under the neurosurgeons.
I think for him, there's actually pretty a long road ahead, even if he gets over this sort of acute problem. It's what we would call a sort of moderately severe head injury, just because he's got the fracture there as well as some blood inside his head. But at the moment, he's still awake and alert and talking to us. So, these are good signs, but a way to go.
Steve amazed doctors with the speed of his recovery, and after 4 weeks was home walking and talking normally.
Hi, it's Terry, Orthopaedic Tech.
It's been a hectic day already for the orthopaedic technicians. But with 30 years' experience behind him, Master Plasterer Terry takes it all in his stride.
Tuesday's usually complete bedlam. You can have up to 100, 200 patients coming through.
He's on his way to see mountain biker Gareth, who's just crash-landed.
I was riding along and I did a jump and his handlebars snapped and I felt like I think my arm went underneath my body and I rolled over it.
Luckily for Gareth, his riding buddy Justin wasn't too far away.
He had a loud scream and knew he wasn't in good shape because he never screams. Knew something happened.
X-rays ordered by Dr. Eliane show a nasty dislocation of his elbow and also a fragment of bone which has broken off on impact.
Well, I'm not really sure if I'll even be able to do my job. I need both arms to be an electrician, really. So, yeah, boss is going to be happy about that.
So I'll give you some more pain relief now, and then we'll get started.
Helping Terry get Gareth's elbow back into position is intern Andrew Little and resident Elizabeth Sheffield. And lucky for them, they'll be learning from the best.
And when you're going to sleep, if you focus on something that makes you really happy, sometimes you have a really cool dream.
Happy places. Let's go to my happy place.
An injury like this dislocated elbow is extremely painful. I've called it diversion therapy for the last 30 years, because they know they're in a bad situation. So if they can focus on something else, something a little bit pleasant, if your brain can even take that away a little bit, you can cope a bit better.
Traction for now. Okay.
You got a really good grip?
Yeah. Just do what you gotta do, guys.
We'll put you there a little bit more to sleep.
Yeah. So we'll put it back down.
But the drugs aren't working.
Oh, my God.
Like that.
Gareth and his mate Justin were mountain biking on Mount Tamborine when Gareth came off his bike, badly dislocating his elbow.
There's also a small piece of bone that's broken off one of the bones in your elbow. Okay. So for sure it needs to be put back in place.
But even in the experienced hands of orthopaedic technician Terry, the task of getting it back into position is proving tricky.
Really good grip. You'll feel it quick.
How are you doing at the moment? Are you okay?
Arm down that way a bit.
Got it.
If I help you.
Yeah, there. You're doing fine.
Oh my God. Yeah, there we go. You need a minimum of 3 people to get that arm back in. Yeah, you need one holding that end, one holding the other end, and another guy. It's really difficult. I'll just show you how you do it. Again. If somebody really hangs on there, you do the foot thing, and you really pull down.
Oh, my God.
Like that. And when you feel it pull past the end, just slip up. So if I give you a hand.
Yep.
Are we sure it's not in?
Just, with those fractured bits.
Yeah.
I just want to be sure before we go up.
Yeah, for sure.
It'll be supple.
Yeah.
Will it come up?
Do we have flexion?
That feels pretty good.
I think it's back in already.
It looks good, yeah.
With a bit more tugging than they first anticipated, it's job done.
Yeah,
But it wasn't exactly the view that friend Justin had planned taking in today.
It wasn't that easy to watch. He yanking pretty hard on his arm. Got a few photos, so you won't believe it.
All that's left for Terry to do now is wrap the elbow in plaster.
I feel better now.
Yeah, so we're really happy. It went very well. He's probably going to be sore tomorrow, although the pain should be better with the reduction done now.
Something about when it clicks and comes in, it's a good feeling.
It's a team effort, and if we've got, we can have somebody with a rating 10, which is the worst pain imaginable, we get them in a nice comfy cast within 10 minutes, they're down to a pain level of 0 and they're walking out the door really happy. So instead of spending a lot of money on having people in hospital, if they've got a nice comfy cast on, they know what to do, they can be home with their family resting it up, taking it easy.
So ready when you are. Okay. Take a deep breath. Big push all your energy right down.
Corinne is 1 month away from her due date, but nobody told her little baby boy, who's on his way today.
So unfortunately, the vacuum keeps coming off, so I'm just going to slide some forceps around the baby's head instead.
Okay.
If Corinne's baby can't be delivered with forceps, then the only option is an emergency cesarean. Either way, it's a tiring and traumatic experience for her baby, who will then have to go through surgery to fix the blockage in his bowel.
Sorry about that.
Can I push in the air?
Nice and slowly.
Can I?
If you got the urge
What
to.
do I need?
Yeah, okay, push.
Let's nice and slow. Slowly.
Take a breath for me, Corinne. And just some nice little puffs for me.
Oh, that's his head, darling.
Now another push.
43, head out.
Got another push for me.
Push.
After more than 20 hours, finally, their little fella arrives.
You were a bit twisted there, weren't you? You were a bit twisted there. There you go. Is he free? Is he free? Oh, yeah. Look how big he is.
Hello.
At last, Corinne and Roscoe can enjoy the first moments with their baby boy.
Together, his name is
Chase Benjamin Patterson.
But their joy is clouded by the knowledge that baby Chase can't drink any milk because nothing can pass through his digestive tract.
It's good to finally have him here and we can go on to the next step of, just making sure he's okay and then, Made it a bit tricky, but that's okay.
Until the surgical team opens up Chase's tiny tummy, there's no way of knowing exactly what's causing the blockage or how to fix it.
got him out in the end, didn't we?
After a long and difficult delivery, little baby Chase has been taken for life-saving surgery on his blocked bowel. It's now over to the leader in paediatric surgery, Dr. Deborah Bailey. Unless Dr. Bailey can find and repair the blockage, Chase will be unable to swallow and digest any food.
Sit there. You can see that this is enormous. All this one big dilated mess.
It's an anxious wait for new parents, Corinne and Roscoe.
Deborah Bailey, who's a surgeon, has done this surgery for 25 years and not had challenges, so I'm good, I'm solid. That's a good enough fact to keep my brain safe.
Yeah. The problem we always have with this is that the anatomy is abnormal.
Yeah.
So we can't work out what's what. That's a nasty bit of bowel. So large. Little Chase had a gap in the bowel called the duodenum, which is around the level of the pancreas, which is just after the stomach. And you can have a partial gap, a full gap. In fact, he had a full gap. And because you swallow fluid before you're born, and it's not going anywhere, so his stomach and duodenum were getting bigger and bigger. Stomach, stomach, stomach. And then there's nothing. Where there should be something.
So our job is to find the ends so that we can work out whether we can join them together. Everything's obviously very small. The anatomy and the way they react to things is different from adults. They can be born with things wrong with them, so that's something that paediatric surgeons do, dealing with things which haven't quite formed properly before they're born and correcting that if possible. So I'm getting the feeling this is around here might actually be our end.
Right.
It takes Deborah half an hour of careful looking and planning to figure out how to remove a malformed section of bowel and join up the ends.
So I know that that's coming along there quite nicely. So that means my anastomosis will be from there to there.
Yep.
Lovely, thank you. Let's make some holes. Thank you. There's nothing more awesome than saving children's lives. I'm feeling happy. I can feel where it's all coming together now.
Although the blockage in Chase's bowel is large, it comes out easily and the bowel is repaired.
The operation went very well. We're very happy that we were able to fix the gap in the bowel in one operation. And the baby's also coped with the operation very well. It's not over yet. We've got a couple of stormy weeks to get over the operation, make sure there's no complications.
Yeah, all the settings are good anyway.
It's scary for these first-time parents, but a relief the surgery is over.
So baby's done very well from the anaesthetic in the operation. We did find duodenal atresia.
Yes.
So we're really pleased to know there's no stomas, there's plenty of bowels, so we don't have to worry about any of that.
Thank you. It's really good to be on the other side of, one, the birth, and two, the operation. So hopefully everything goes smoothly now. And yeah, we'll take it from here and just go. Still day by day, but yeah.
Yes. It's exciting. It's like now we can have bigger challenges like, I don't know, breastfeeding and I don't know.
Screaming in the middle
Just
of the night.
feel like more normal challenges to face, which will be fun.
Finally, Corinne and Roscoe can relax and enjoy their special baby boy.
Did good, kid.